situation where simply looking at your child causes you to imagine their funeral. That type of situation is one that many families find themselves in after having a child diagnosed with cystic fibrosis. Today I want to talk to you about cystic fibrosis, or CF, and its social and emotional effects on those who have this disorder. This topic is especially close to my heart because my childhood best friend passed away from CF in 2007. Eva was always the friendliest and most joyful person in the room. She never let CF hold her back from enjoying those she loved and making the most of every situation. I believe part of her attitude can be attributed to the community she was a part of. The community surrounding her was constantly supporting and encouraging her and her family, but I can't help but wonder how Eva's life would have been different had that community not been there. Today I'll begin by telling you a little about cystic fibrosis. Once you have an understanding of CF, I'll tell you about how this disorder socially and emotionally affects those with it. And finally, I will offer several ways in which you can support those with CF. Before we can analyze how CF affects those with it, we first have to understand what CF is. CF is a lifelong hereditary disease that is passed along by autosomal recessive inheritance. Autosomal recessive means that both parents have the mutant trait in order for their child to have the chance of getting CF. If both parents do have the CF gene, there's only a 25% chance that their child will have this disease. And according to the Cystic Fibrosis Foundation, 1 in every 29 Caucasian Americans carry one mutation of the CF gene. The rate of incidence goes down among Hispanic Americans, African Americans, and Asian Americans. The defective gene in its protein product work to produce thick, sticky mucus that do two things. The first is that it clogs the lungs and leads to severe, life-threatening lung infections. The second thing that the mucus does is it obstructs the pancreas and stops the natural enzymes from breaking down food and absorbing nutrients. When I was younger, it wasn't unusual to see Eva break open an enzyme capsule and put it in her applesauce, and we even had a bottle of pills at our house so that she wouldn't have to remember to bring them over every time she came. In regards to the age of diagnosis, more than 75% of people with CF are diagnosed before age 2. It is possible, though very rare, that it could go undetected for decades due to especially mild symptoms. Typical symptoms of cystic fibrosis include salty tasting skin, wheezing or shortness of breath, persistent coughing and excessive mucus, frequent lung and sinus infections, growth in the nose, poor weight gain and growth, swollen belly, and broadening of the fingertips and toes. As of 2007, the life expectancy for someone with CF is 37.4 years. This is a significant increase from years past. In the 1950s, those with CF weren't expected to make it to elementary school. In 1985, the median life expectancy increased to 25 years. Currently, there is an estimated 30,000 people diagnosed with CF in the United States, and half of this population is over 18. Daily treatment for a person with CF includes airway clearance to help loosen thick mucus that builds up in the lungs, inhaled medicines, and the ingestion of enzymes, like I mentioned earlier. Now that we have an understanding of what cystic fibrosis is, we can look at how it affects those with it. These effects aren't limited to just the outcomes of long-term treatments, but rather they include the consequences of daily living with this disease and its symptoms. At the beginning of the speech, I mentioned how the presence of a supportive community was especially beneficial to Eva. On that same note, I believe that the lack of that type of community can be detrimental to many with CF. Cystic fibrosis causes these kids to look differently and have to live by a different schedule than their peers. So a lack of support and understanding can make fitting in for school-age kids hard for school-age kids with CF. Feeling like an outsider because of size differences between people with CF and their peers is an especially prevalent concern among those with CF. Body image, for example, becomes a significant issue. Many peers don't understand it's a struggle for those with CF to put on weight. They'll make comments telling them just to simply eat more dessert, and unknowingly these comments and the pressure to eat causes the desire and pleasure of eating to disappear for those with CF. To many, the process of eating becomes a chore. Abdominal bloating is another common side effect of CF symptoms, with 94% of those with CF surveyed saying that it negatively affected their body image. One woman said, "I often get asked if I'm pregnant, and although I laugh it off, it does hurt." Another woman said, "I only wear certain clothes due to my bloated stomach. It stands out so much when you have thin arms and thin legs." These differences often lead to kids with CF being bullied by their peers, and according to a 2012 study by the American Academy of Pediatrics, kids with CF that were bullied were more likely to report that they were depressed or anxious. A watchful eye by a teacher or parent can go a long way in preventing the occurrence of bullying in these situations. The actions of peers are not the only thing that affect those with CF. Their own body is working against them as well. These symptoms lead to numerous and long hospitalizations. Being pulled out of school makes it difficult for those with CF to continue to work at the same grade level as their classmates, causing them to fall behind. As much as these children may want to keep up with their peers, there is sometimes no way to allow that. Eva is often in this situation, having to miss weeks of school at time due to hospitalizations. Finally, her parents transferred her to a school where she was able to work at her own pace and didn't have to worry about staying on grade level. Another issue that those with CF have to deal with is the reality of their limited lifespan. Children in a study called The Psychosocial Implications of Cystic Fibrosis were quoted saying that they felt like they were living in the shadow of death. This limited lifespan, along with other medical factors, contribute to the presence of psychological diagnoses among those with CF. Specifically, according to a 2011 study, 60% of children with CF met criteria for a psychological diagnosis. Anxiety was diagnosed in 35% of those, and depression was diagnosed in 33%. Now that we've had just a brief glimpse into how CF can affect those who have it both emotionally and socially, I will give you several ways in which you can help those with CF. The first and easiest way for anyone to help support those with CF is by donating their time or money. The Cystic Fibrosis Foundation's website, cff.org, gives several great options for donating. These donations go towards improving therapies and funding research. Another way that you can get involved is by participating in a fundraising event. There are several different options, including Great Strides, CF Cycle for Life, CF Climb, and Extreme Hike, to name a few. I've participated in the Great Strides event several times. This event is a 5K walk or run that teams sign up for and work together to raise money for. This money then goes towards funding cystic fibrosis research and drug development. What I remember most from Great Strides is the sense of community, hundreds of people coming together to support one common goal. Among the people there, you would see those currently living with CF, and also teams walking in memory of a loved one who had passed away from CF. Both serve to remind us what our purpose is in being part of this exciting event. In conclusion, my hope is today that you've learned a little more about cystic fibrosis, how it affects those with it, and what you can do to help. I'm also hoping that by spreading the word about cystic fibrosis, more people will look for ways to support families dealing with CF and the various CF foundations. Growing support of these groups will lead to breakthroughs that will allow mothers of those with CF to look at their children with new hope.